morning. I'm the doctor who will be taking care of you today. And remind me what your name is. Okay, perfect. And you are here for an annual exam. Can you confirm your date of birth for me? Then just a few questions before we get started. Do you have any current health issues? Okay, and when did that start? Any past health issues? Okay. Any allergies? Okay, and that's including food and medication. Okay. Any health concerns at the moment? Jaw pain? Okay, can take a look at that. How many hours of sleep do you get every night? Okay, good. How much water do you drink per day? Are you taking any prescribed medications? And how often? Any vitamins or supplements? How often? Okay. And then anything else? Let's see, when was your last vision test? Let's put that down here. Yeah, that's fine. We'll just do a quick check today. Last dental exam. Any surgeries? Okay. And then besides your jaw pain, you've been feeling well otherwise. Okay. So no recent illnesses. Okay, perfect. Alright. So then I think we can get started. Just going to start off by putting on some gloves. And are you new to this office? Okay, so you haven't been here for a while, no problem. I know sometimes I do forget to get my annual checkup as well. So don't worry, we'll make sure you're healthy and well. I'm going to start off just taking your blood pressure. So just slip your right arm through this. Go. Very good. And now just relax for me, okay? Very good. So blood pressure is normal. You can take your arm out. Now I'd like to check your heart and lungs. So I'm just going to place this on your chest. Okay, good. And just breathe. Very good. Just relax. Just going to place this on different areas, okay? Good. lungs. So, deep breath for me. Just going to place this on your back. Good. Another deep breath. Good. Deep breath. Good. Deep breath. Good. So now I'm just going to tap your back. So just stay still for me. Good. Okay. Can you give yourself a hug for me? Okay, good. Okay, and then can you just lay down for me? Yeah, just lay back a little bit. Perfect. And I'm just going to tap this gently on your abdomen. Is that okay? Okay. Yeah, it won't hurt. Okay, so just stay still. No pain. Good. No pain. Okay. Alright, so now I'm going to just do a brief hearing test. Just two quick things using a tuning fork. And have you had your ears cleaned at all recently? Okay, yeah, that's not a problem. Yeah, I know that's something I always forget to do as well, so it's okay. I would just recommend going if you have any hearing issues, hearing loss, any ringing in your ears, or if you just feel like in general they need to be cleaned. And I can give you a really good doctor recommendation too, if you need one. Alright, so this is a tuning fork. Have you ever seen this before? Okay. So basically what I'm going to do is just strike it, and then I'm going to place this on the top of your head. Then you're going to let me know if you hear the vibration in your right ear, your left ear, or both. Okay? Alright, so I'm just going to strike this and then put it on your head. Okay, so right ear, left ear, or both. Okay. What do you think? Okay, perfect. Very good. So now I'm just going to strike it again and then gently just place it on different parts of your body. So your arms and then your legs. Okay? So same thing, just let me know if you feel it this time. Alright. So starting with your right arm. Do you feel that? What about here? Feel that? Here. Feel that? And then what about here? Okay, good. Now I'm just going to do the same thing on your legs. Okay, so left leg. Good. And then your right leg. Good. Okay. Perfect. Alright, so your hearing test was fine. And then the second test kind of led into the sensation test I will be doing next. Let me just take a note here. So similar to what I just did, I'm going to just brush this cotton swab on different parts of your body. And I just need you to close your eyes and let me know when you feel it. So here we go. Good. 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 Okay. So no questioning, you felt it every time. So next is another similar test. Just going to be using this brush though. Just going to gently brush it against different parts of your body. Okay? Let me know when you feel it. Good. 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 Okay, good. All right. Perfect. Okay. So now I will be feeling your body. I'm going to just do a skin check for any bumps, any pain, and also checking your body temperature. So first I'll start with your lymph nodes. Just look directly at me. Good. Feel right here, any pain. Okay, what about right here on your chest? Okay. Now your back. Pain right here. Okay, just taking a look. No bumps, no bruises. Okay. See your arms, just stick them out for me. Good. Okay, looks good. Looks good. And then your legs. Okay. Looks good. And this one. No pain. Okay, good. So next I like to go back to using this reflex hammer for a few tests. And just as a reminder, this actually is used to test the nervous system. And this specifically will help me test deep tendon reflexes. Okay? So I just really need you to relax completely for me. So you can close your eyes, take a nap for a few seconds. Okay? So close your eyes again. I'm just going to start by tapping the back of your foot, which is the Achilles tendon. Okay? Just a few taps. Good. Good. Now just rest your arms in your lap. Good. Check your biceps tendon. Very good. Rest your hand on your hip loosely. I'm going to test your triceps tendon. Now this one. Very good. Just open wide. lift your tongue, move it to the left, move it to the right. Swallow for me. Good. Okay. Say open real wide. Good, good. Just writing this down. Everything's good so far. Just a few more tests. Now with your jaw pain. So are you grinding at night? Clenching? Okay. Alright, so let me just feel. Just gonna be gentle. Can you open your mouth for me? Good. Now close it. Do you have any popping? I feel a little bit on this side. Okay. Do you ever do any exercises to help? So I'm going to suggest something. So this is just an ice roller. And I'm just going to gently rub it on that side of your face where you said there's some pain. And I do feel a little bit of inflammation. This will make it just feel a little bit better, okay? And you just keep this in your freezer and use it whenever you need it. So I'm just going to rub a little bit. How does that feel? Good. Okay. Feel better? And you can do that for as long as you'd like until it starts to feel a little bit better. And I'm also going to just rub some of this on your face as well. And this is just a calming roller with a little bit of CBD in it. And I like to just rub it on my jaw whenever I get pain from clenching, and it really helps me. I'm just going to rub a little bit. You'll feel the soothing feeling. Feels nice, right? Okay, good. Perfect. Alright. So what I would also say is if it gets to be any worse, definitely see a TMJ specialist. They'll be able to properly diagnose you, take x-rays, and just make sure everything's okay. Alright? And then next, I'd just like to take a quick look at your pupils. I'm not going to do an entire eye exam today. No, just checking the pupils. So just look right here. Good. Good. Very good. Look right back here. Look right back here. Good. Look up for me. Look down. Good. Okay. Look straight ahead again. Okay, good. Now just follow this light for me. Okay? So follow exactly where it goes. Good. Perfect. Alright. You said your last eye exam was about 1 year ago. So yeah, once it hits the 1 year mark, I would definitely suggest going back. So just one more test. And this one is actually just a scalp test. So I'm just going to take a look, see if I see any bumps. Do you have any dandruffs or itchiness? use this comb to separate some areas. Looks like your scalp is a little bit more oily. Alright, so it looks good. Just gonna feel your head down. For any soft spots. Feels very normal though. No bumps. And is there anywhere that's tender when I rub? Okay, good. Looks healthy. Overall, no thinning and no abnormalities. So you have beautiful hair. Very good. So you can just rest back again. Let me just make sure I did everything. I think I did. Nothing was missed. Anything else you wanted to discuss? Okay, so I went over the jaw recommendations. You can also look up videos on YouTube if you need more help. And like I said, if it gets any worse, I can recommend a doctor for you. Especially if you have trouble opening or closing your mouth. And you can also actually get a night guard made as well. So just things you can look into. But other than that, you're in great health. So good job. Keep up the good work with your water intake, exercise, eating healthy, things like that. And I'm going to have the nurse just get a blood sample if you don't mind. We'll send that out, make sure all of your levels are good, okay? And I should have those results within about 2 days. So I will follow up with you. And then you'll also see the results uploaded into your portal. Any last questions? Perfect. Well, it was wonderful taking care of you today. Feel free to reach out at any time with questions if they arise. And of course, if you're not feeling well. Okay? Alright, well, thanks for coming in. And I will see you next year.